Chickenpox and shingles symptoms, your immune system risks. Chickenpox, shingles, and your immune system. What is chickenpox and shingles, and how does it affect your immune system? Here is the third video of the Natural Health Guy's Secrets of the Immune System video series. In this video, you'll learn how chickenpox and shingles are related, and their impact upon your immune system. What is chickenpox and shingles? Here are 8 attributes to give yourself a good understanding. Number 1. The virus that causes chickenpox is called Varicella-Zoster, and it's highly infectious. Number 2. It enters through the respiratory tract, and from there it will spread all over your body. Number 3. It can also infect your nervous system. Number 4. The resulting symptoms are a bout of chickenpox. Number 5. Many people think that having chickenpox is a one-time disease, and that once caught, confers lifetime immunity from a reoccurrence. Number 6. Whilst chickenpox may not recur, the causative virus doesn't totally leave the body. Number 7. Prior to the body's defenses overcoming the virus, the Varicella-Zoster virus, which causes chickenpox, will manage to survive in the body and may reactivate later in life. Number 8. If it does awaken, it doesn't cause another episode of chickenpox. It causes an outbreak of shingles. What happens to the Varicella-Zoster virus once you recover from chickenpox? Here are 4 characteristics of the way the virus adapts to your body's systems. Number 1. The virus enters into clusters of nerve cells in the head and along the spinal cord. Number 2. Once an individual recovers from chickenpox, the virus will remain dormant in these nerve cells, which are also called ganglia. Number 3. Unlike other viruses, such as the polio virus and the common cold virus, the Varicella-Zoster virus can successfully hide within the nerve cells. Number 4. They adapt so well that they are able to escape detection by the destructive responses of the immune system. From dormant virus to shingles. People who have had chickenpox or its vaccine are subject to the possibility of experiencing shingles later in life. Here are 6 phases the virus goes through to generating shingles. Number 1. If the dormant virus is reactivated, it will start to multiply. Number 2. The antibodies left in your system from your chickenpox bout are supposed to neutralize these viruses. Number 3. If your body's immune system is not at its best, the antibodies may not be strong enough to stop the virus from reproducing. Number 4. The viruses will then keep on multiplying in the sensory nerve clusters. Number 5. It then spreads down your nerves, affecting your skin. Number 6. You will then experience a painful and tingling skin rash. The difference between chickenpox and shingles. Although chickenpox and shingles are caused by the same virus, they affect your body in different ways. Here are 11 explanations as to how and why. Number 1. When you have chickenpox, your body will suffer from its widespread infection. Number 2. The subsequent rash can appear all over the body. Number 3. While chickenpox exposes you to a lot of itching, shingles will more likely make you sense more of a tingling or stabbing pain, and not just itching. Number 4. If you contract shingles, you will only have a rash on specific areas of the body. Number 5. This is because the virus is reactivated in a way that only those specific nerve clusters are affected. Number 6. Where it appears on your body depends on where, in your spinal column, the virus has parked itself. Number 7. The affected area is that which is affected by the nerve network that radiates from where the virus is lodged. Number 8. In most cases, shingles only affects the face or the chest. Number 9. If a person is subject to reoccurrences of shingles, their affected area is usually the same as with previous outbreaks. Number 10. It's not unknown for the rash to appear in a different place on your body. Number 11. When this happens, it's believed that the virus has re-established itself in a different spinal position. The symptoms of shingles. Shingles will usually start with itching and tingling sensations, sometimes accompanied by a stabbing pain. Here are 9 typical ways in which this occurs. Number 1. The skin on your body and face are among the most commonly affected areas. Number 2. After a few days, a rash will start to appear that looks like fluid-filled blisters, very much similar to that when chickenpox appears on your body. Number 3. These blisters will later dry out and turn into scabs. Number 4. During the early stages of shingles, you may feel intense pain even when no blisters are present yet. Number 5. This is the reason why some cases of shingles are wrongfully diagnosed at first as pulled muscles, which is why some people can experience shingles differently. Number 6. Some may experience the rash in a tiny area of only a few blisters, yet still have all the other discomforts, whilst others may have a rash over a large area. Number 7. The shingles rash generally affects only one side of the body, which relates to where the virus is located in the spine. Number 8. Shingles will usually last from 3 to 5 weeks. Number 9. Since shingles is technically a viral infection, you can also suffer from fatigue, chills, fever and muscle aches. Who is at risk of shingles? To date, experts aren't 100% sure of what triggers the reactivation of the Varicella-Zoster virus. However, in most cases shingles affects those who have decreased immunity. If you're diagnosed with shingles, it means that your immune system is in a weakened state. 3 factors resulting in decreased immunity are smoking, alcohol and a poor diet, and that leads to chronic inflammation. Irrespective of what other factors weaken your immune system, reducing chronic inflammation in your body is key to building a strong and healthy immune system, and that requires getting your cellular health back into balance. Here are 4 categories of people most at risk of shingles. Number 1. Older adults whose immune system response declines as they age are more likely to suffer from shingles. Number 2. Exposure to excessive physical and emotional stress is known to increase the risk of a shingles outbreak. Number 3. People diagnosed with cancer, kidney and lung disease also face a higher risk of experiencing shingles. Your risk of shingles increases dramatically once you reach the age of 50, and the risk increases by up to 40% in every decade that follows. How stress triggers the Varicella-Zoster virus outbreak. All forms of stressors affect the functional interaction of both the immune system and the central nervous system. The severity of immune dysfunction depends on the duration and frequency of the stress response. Here are 8 ways in which stress triggers are activated. Number 1. Stressors trigger the release of stress hormones, such as cortisol and catecholamines. Number 2. The persistent existence of these stress hormones in the body further depresses the immune system. Number 3. Suffering from diseases that cause chronic and severe pain also triggers the reactivation of the Varicella-Zoster virus. Number 4. Chronic pain also brings with it emotional distress, and so the destructive cycle continues. Number 5. Stress-related trauma and surgery can also cause the reactivation of the Varicella-Zoster virus. Number 6. Psychological stress is another factor that contributes to the likelihood of a Varicella-Zoster virus outbreak. Number 7. A lack of social support from friends, family or spouse can be an underlying cause of distress upon a person's psychological well-being. Number 8. Research shows that people who had a herpes-zoster outbreak had often undergone a negative life event 2 to 6 months prior to the onset of a Varicella-Zoster virus outbreak. Why stressed individuals are more prone to a Varicella-Zoster virus outbreak. Here are 4 reasons why. Number 1. People who are under a lot of stress often find it hard to sleep well at night. Number 2. They are also more prone to unhealthy eating habits as their way of coping with stress. Number 3. When many people are stressed out, they tend to resort to increased levels of harmful vices such as drugs, alcohol and cigarettes. Number 4. Although these substances can have a very temporary ability to mask the problems causing the stress, they all further negatively impact the immune system, thus increasing the likelihood of having a Varicella-Zoster virus outbreak. How to boost and strengthen your immune system. Here are 3 key ways to do this. Number 1. To strengthen your immune system and to help stop shingles from spreading to other areas of your body, ensure you change your dietary and eating habits. Number 2. Cut out eating processed foods, including sugar-rich products such as cakes, sweets and chocolates. Number 3. Change your diet to include foods and natural supplements that contain 1. Vitamin A, such as broccoli and carrots. 2. Vitamin B6, such as chicken. 3. Vitamin B12, such as eggs. 4. Vitamin C, such as grapefruits, oranges, red bell peppers and spinach. 5. Vitamin D, such as oily fish, which also include omega-3 fatty acids. 6. Vitamin E, such as almonds. 7. Vitamin K, such as Brussels sprouts and cauliflower. 8. Zinc, such as shellfish. 9. Iron, such as red meat and ginger, and 10. Manganese and selenium, such as garlic. Summing up. Number 1. The Varicella-Zoster virus is the cause of chickenpox. Number 2. The virus can lay dormant in your spinal cord and reactivate later on in life as shingles. Number 3. Those at risk of shingles have a weak immune system. Number 4. Stress often triggers the shingles virus. Number 5. Stop eating processed foods and increase your intake of fruit and vegetables, meat and oily fish. The Secrets of the Immune System video series is continued in the next video, which covers signs your immune system needs a boost. To become an exclusive subscriber of this channel, don't forget to subscribe by clicking on the subscribe button in the bottom right corner of this video, and then click the grey bell icon to ensure you get notified of when the next video is uploaded to this channel. Many thanks.